So welcome to this learning event. And I'm Lesley Carter. I work for Age UK and I'm the head of health and care clinical practice, but I also lead the malnutrition task force. So I was having a think this morning. This actually is the 11th learning event that the MTF has run over the years that it's been going. I think that's quite a thing. So today it's the 8th year that we joined with BAPEN to run Malnutrition Awareness Week. So I thought we also ought to take this opportunity to have a bit of a recap of what's been going on with the MTF. There's been a few changes recently, and I'm sure you'll be interested in that. So as you all know, that Diane Jeffrey was our chair, and she was our chair from the inception, and she was made a Dame. So we think that's wonderful and congratulations to her. Sadly, Diane stepped down at the end of the year and we miss her dreadfully, but we'll always be grateful for her guidance and her leadership and as well as her wisdom. And also Appetito, who have funded us through the entirety of the MTF's life, have also stepped back from the MTF. And we thank Paul and Lee so much because they've always been there over the last 11 years or so. So thank you very much indeed. So moving us forward, we had to have a think about what we could do, how it would work. We haven't actually replaced the chair, but we have got our leadership team. And these are the people who've been working on the MTF for a very long time now. And we all come with our own set of unique skills. So that means that the MTF has a real rounded guidance and professional aspect to it. So I lead it, so I provide the content and give a general clinical overview and guidance to the team. And Kate Hall, gives us our steer consultant dietitian. Phil Shelley, he's in NHS England and he brings his expertise around providing good quality food and service in hospitals. He also champions those chefs who work in hospitals, care homes. And as past chair of the Hospital Catering Association, he's really committed to raising that profile about malnutrition. And Sarah, she's here, and Sarah supports us all around Meals on Wheels, about well-being, helping us to understand what actually happens to people in the community, how they're struggling, what's good for them, what they need more help of. And she really believes in the power of social business to deliver that high quality and sustainable services. And Jane Murphy, she's a professor of nutrition and a dietitian and a nutritionist, and she supports us academically. So we're a nice, neat little team, and we work really well together. And it's been quite exciting to try to work a little bit differently. So I thought I'd better set the scene. What's going on for older people? So we know that we're all getting a bit older, we're all living a bit longer, but sadly not always in the best of health. And it looks like people are going to age and we're going to have many more older people as time goes on. Worryingly, the number of people aged over 85 is projected to grow a lot. And they find it very difficult. And with their unmet needs and difficulties with social care, I think it's going to become a challenge. And look, so many of us are going to live to 100. When we think about, what does it cost to keep people who are malnourished, to look after them, to provide for them? BAPEN has done some really good analysis here, and you can see on the screen the difference that it costs to look after people who are not malnourished and people who are. And we ask ourselves, why is this happening? So we know that social care spending has reduced, and the number of people who are caring over 65, that's increased dramatically. And people also 75, 85 who are either caring for parents or they're caring for their spouse or their children. And these people are really struggling to eat a proper diet to keep themselves well. And this constant concentration on the health impacts of obesity. Obviously, we do need to push that message, but not to the detriment of malnutrition. There's a lot of people who are very undernourished. They have preventable malnutrition, and this is not a good thing. We're finding that people are finding themselves losing their independence, perhaps earlier than they should. And it's often because they can't get access to good quality care. They can't get the people to help them with their daily tasks. They can't prepare their food. They can't go shopping because all the shops have closed since COVID. They're now in retail parks. And if you can't walk really well, your mobility's not good, and you can't get public transport, you can't get a taxi, how are you going to get there? So people are finding it exceedingly hard to plan, shop, and prepare. And we're not really thinking about, if we give people food, the most important thing is how are we getting it from the plate to the mouth? Because we often think, okay, we'll give them a sandwich, we can get a ready meal, we can do this, but we're still not thinking of how people can actually eat that food. How are their teeth? How's their swallowing? We're not really looking at that. We need to improve. And I think the other thing that is really important here is that myths continue, that losing weight is inevitable as we age, and it's quite normal to be thin as you get older. And we know actually that that's not right. So we, over this year, have updated our resources to try to raise the awareness of what is happening around the state of the nation. So this has been updated, and you can find all the stats, you can find the data and trends in there. It's in online, but if you would like a hard copy, we can actually post that to you. And we've also updated our Eating Well in Later Life, which really talks everybody through in a really easy way about what are the issues, about whether you should take vitamins, how many meals you should have, whether you should have soft food or not, how to measure yourself, because that's important. There's a supporting animation that you can find on the website too. So all of these resources can be requested from the website. So please do that if you would like them. And people do tell us that they find them really, really helpful. So while we're talking about resources, I thought that I would just remind you all of the Let's Talk About the Death and Dying. So that has got quite a significant piece in about what people need at the end of life. Because as people enter the end of life, we worry somewhat about what they're eating and drinking. And I think that the people who are watching become very distressed and anxious. And people have told us that the information in that booklet really helped them to understand what was going on. Our latest booklet is about, let's talk about our wishes for our future healthcare and treatment. And you can order that, just buy one or in bulk. And that goes through advanced care planning, having a conversation, being in control about what you want to do, making decisions, discussing it with your families. And the last thing is the End of Life Mythbuster. We wrote that when we were talking about assisted dying, because we had a lot of information from older people that they were getting really worried that they would be included in this without actually knowing. And the upshot of that, the unintended consequence, was that professional staff found that people were no longer happy to talk about their wishes. So we want to make sure that everybody understands what it's about, talking about death and dying, making decisions, and actually what it means about the assisted dying. So you can order all of those from the website. So we really need your support more than ever now. So as we know that people are living longer with more and more complex needs, challenges in health and social care, it's more important than ever that we make sure that people understand about preventable malnutrition and are able to tackle it. So if you know of any opportunities for funding or anybody who could help us, or anyone who'd like to join us, please get in touch with me and I'll get back to you. I'd really appreciate that. Thank you. So what this is all about is Malnutrition Awareness Week. So our thoughts this week is about the ask, look and listen. So we've got to make sure that we know what's going on with those people that we are caring for. People, if we're a professional who we're visiting in their own homes, people who come into hospitals, and we must understand and accept that malnutrition is actually everybody's business. And we mustn't forget about hydration. We talk about nutrition, but hydration is up there, of course, as well. And as soon as it's spotted, we want everybody in health and social care to know what to do about it. And it is about asking people how they're doing. Don't be afraid to ask them how their appetite is and can they cook their food. Really look around, is their fridge full? Have they got something in their cupboards? And then listen carefully, because as they talk to you, they might not be talking about food, but actually that's what they mean. But some people might find it very difficult to say that I can't eat, or I can't eat because I'm lonely or because I'm unwell. And it really is up to us to ask, look, and listen. So we've had the theme days for this 2025. We've got a screening that's still going on, and you can find that on the BAPEN website. Yesterday, we had Challenges Tuesday with solutions, and it was quite active on social media. And we'll be sharing some of those challenges and solutions on the website after the event. Today, we're looking at hospital discharge, how we can make sure that people come out of hospital, that they are equipped to care for themselves, to get enough food to eat, and to make sure that they don't continue in that downward spiral of losing weight. Thursday, and that's about nutrition and hydration, because we know that sometimes we forget all about hydration. And we've got some really good resources on the website. First but a drink, that's something that reminds us all about how important it is to drink. And Friday's about what we all should be doing, make sure that every contact counts. So whoever you are, whether you're from the voluntary sector, from hospital, community, neighbours, make sure that you ask, look and listen and think about malnutrition when you see people. And during the weekend, we're going to show some highlights of our superheroes, and there are loads of you. And thank you for all that you do to support this. So today, excuse me, at the learning event, we've got a really good, excuse me a moment. Sorry about that, it's really dry in here. We've got a packed full agenda, and we're going to hopefully find some really interesting things that you didn't know before. We're going to cut all this up into pieces, put it on the website so you can look at it in your own time, because I know that people can't have study leave, and it's very difficult to spend a whole day listening to presentations. So as in previous years, that's what we will be doing. And you'll be able to find it in probably about 3 weeks, I would think. Takes a little bit of time to get all this done. So Age UK have done a really interesting piece of work here. And we've called it The Longest Wait. And it's about the A&E crisis. And it's about corridor care. And we know that it's not just older people that are caught up in corridor care, although we know it's much more common in this age group. And I'm just going to give you a quick abridged version of this Age UK report. You can download the report from the website, and I think it will make really interesting reading for you. So why we chose this campaign now is because it feels like corridor care has become an inevitability, and it really isn't. Because a decade ago, corridor care was virtually unheard of, and now it's in danger of being normalised. And the scale of this problem has just taken a quantum leap in recent years. And Age UK shows that a shocking 525-fold increase in the number of people who are being kept in corridors for more than 12 hours. You know, that's really bad. And it's making older people feel that they don't want to go to hospital, that they're too frightened to go into hospital. We can see that they're the hardest hit. And it's really undignified and horrible for older people to be waiting in corridors. And we know also that patients who spend more than 12 hours in an emergency department are twice as likely to die within the next 30 days as those treated and transferred or discharged within 2 hours. You know, not good thoughts, is it? And the impact that we have on patients is really difficult. People have experienced awful things. They have watched people die beside them. They've caught other illnesses because they've been in the corridors. They've not had much privacy and dignity. People have been lost in the confusion. And I think it's very easy for us to be highly critical from Age UK, but we recognise how difficult this is for staff. Staff are finding it hard every day to go to work, and they feel that they can't provide the care and the attention that they want to. And we at Age UK feel that we need to be looking above that and think about what are the causes. And people think it's a lot about the demand in A&E, but actually it isn't. It's about the hospital flow. It's about diverting people from, it's not about just diverting people from A&E. It's about solving that crowding and corridor care. And it means focusing on the blocking, what's happening, learning what's happening in your area, and addressing that exit block where people get stuck in hospital because of poor planning or lack of available community care. We know all this. It's not new, but we have to really start to challenge the government to do something about this. So, you know, what really needs to happen now? We need to have a minister who is appointed, who is accountable, and they have to report on what they're accountable for, and they need to be questioned if it's not working. We need to have a funded operational plan which actually accepts that there are these incidents of long waits and think about what can we do to end this. giving, proper deadlines and milestones that we can all follow, and so that everybody feels that something is happening. We also need to know what's going on, so we have to have a robust system to collect and publish that data. Because if we don't, everybody's going to lose faith. And for our NHS, that's a really sad state of affairs. And we need to look at people who are doing it well. Some people don't have corridor care, and we need to have a peer learning program so that everyone can work together and share their information, share their good practice. And we need to work at pace to get the 10-year plan sorted out. It's got to be implemented, especially that shift, hospital to home, and the creation of neighbourhood health services. And we need to make sure that social care and the voluntary sector are fully in there, that they can help. There's lots that they can do. And so fewer older people will ever need to come to A&E in the first place. So that is just a whistle-stop tour of our report, The Longest Wait, and you can download it from the website.